Welcome to this OR Live webcast presentation, live from Shawnee Mission Medical Center in Merriam, Kansas. During the program, it's easy for you to make referrals, make appointments, or request more information. Just click on the buttons on your screen and open the door to informed medical care. Welcome to this OR Live webcast presentation, live from Shawnee Mission Medical Center in Merriam, Kansas. During the program, it's easy for you to make referrals, make appointments, or request more information. Just click on the buttons on your screen and open the door to informed medical care. OR Live, the vision of improving health.
Good evening. My name is Bill Ritter. I'm a cardiologist at Shawnee Mission Medical Center at our Heart and Cardiovascular Center, which is located in Shawnee Mission, Kansas. Shawnee Mission, Kansas is in greater Kansas City area in the county of Johnson County and in the city of Merriam. Tonight we're going to have a two-part program. First, we're going to have a cardiac procedure performed live. This will be a Transesophageal Echocardiogram performed by one of my partners, Dr. Jeff Bissing. And then secondly, we're going to have a panel discussion about mostly peripheral vascular disease. Dr. Mike Beasley and Dr. Joe McBride will be our panel discussants about vascular disease. So good evening, gentlemen.
Good evening.
And first of all, we'd like to go live to our presentation. This is a transesophageal echocardiogram procedure. It's a fairly common procedure we do, and we will tell you more about what the procedure is like and indications as we go through the procedure. So we're going to turn this over now to Dr. Jeff Bissing. Are you there, Jeff?
Good evening, Bill. We're here getting ready to start this transesophageal echocardiogram, kind of update you to where we are right now. We have a patient who's a young patient who had a echo done of their heart from the outside of their chest, and that basically showed a valve that looked to be structurally abnormal, probably born with that situation. So we're doing a transesophageal echocardiogram where we put a probe down into the esophagus, which is your swallowing tube, and from there we can get better images of the heart to really see what's going on a little bit. So that's what we're going to be doing tonight. We've already kind of started ahead of you. We've already got the probe down. The patient's comfortable and sedated. And I think what we're going to do next is start looking at some images. And I think as we go through this, I'll try and point out as best I can what we're looking at on these images of the heart. And we'll just kind of go through and show some anatomy, basically what's normal anatomy and potentially what's not completely normal anatomy. So we'll go ahead and get started here and start looking at some pictures. This right here, as you look at this on the screen, there's a thin structure in the middle there. That's actually the tricuspid valve, and that's a valve that separates the top chamber on the right side of the heart called the right atrium and the right ventricle. Blood typically doesn't have oxygen and comes back to the heart and comes into that top chamber on the left there, goes through that tricuspid valve that's kind of flipping in and out there, and goes into the right ventricle. From there, blood flow goes over to the lungs and gets oxygen. Once it gets to the lungs and gets oxygen, we'll kind of look a little bit later at where it goes from there. What I kind of want to focus on first is kind of in the center of the screen. Looks like a circular type of structure. You can give more Versed if you want. Looks like a circular type of structure. And you see a valve in there, too, that's opening and closing. The interesting thing about the anatomy here is what you see is kind of two leaflets, and I hope you can see that well in there as well, Bill, but basically two leaflets and what we would call a bicuspid aortic valve. Typically,
normally it's what, three cusps, Jeff? Is that right?
That's exactly right. Typically, these aortic valves have three cusps, and basically it's three leaflets. And as you see here, kind of we can zoom in on that aortic valve, and we'll show you a little bit more here. But that aortic valve typically would have three leaflets that open and close. Now, the good thing here, just looking at this really quick, is you can see that there are two leaflets, and they open and close, and that's the structures coming in the center there. And they're still open well, so there's not a lot of calcification or a lot of problems with this valve right now. It looks like it really opens up nice. We were a little bit concerned from the initial ultrasound that probably there was a high gradient across this valve, but really I'm a little bit skeptical of that right now, given the fact that the valve really opens well and really looks good. So we're going to kind of rotate things around. We're going to stay focused on that valve, and by having some rotation in here with this device, we can actually look at the valve in what I would say is a different plane. So
look at that very clearly.
In the center of your screen right now is, again, the aortic valve opening and closing. To the right, the narrow tube, that's actually the aorta. So blood flow is going through that valve and goes out through the aorta and goes to the rest of the body. It's a way to get that oxygenated blood that I was talking about before out to the rest of the body. So it goes out through that valve, and we'll kind of look at anatomy a little bit more. I'm going to kind of pull back here, and you can see the aorta a little bit here too, which is the structure lining the whole screen there for you. And that really looks pretty good. Looks probably like a normal size aorta. We're going to slide back down and go back to this valve again.
Isn't it a beauty of TE, this procedure you're doing, and we can see the valves so well?
Absolutely. Can see them much better, no doubt about it. So, kind of do a regular echo from the outside as some initial screening. And the benefit here is that with this procedure, I can actually get much better images of the heart and kind of see things a little bit more defined, which can help in a lot of things. A lot of situations as far as if people have abnormal valves and need surgery or things done, gives the surgeons a lot better detail on what's going on. We're going to put some color across this aortic valve now and kind of...
See, we're much closer with the transesophageal probe, which is in the esophagus, right? The esophagus runs right in back of the heart. It's just a very short distance, so isn't that why we get better pictures? We don't need to put sound waves through the heart, the chest and all that?
Absolutely.
Much closer to the structures. We
absolutely get much better images, no doubt about it. And the benefit of this is that you can, again, detail anatomy much clearer. The outside you can get pretty good images. I will say, though, that a lot of times, depending on the patient, because a lot of times anatomy of the patient makes it very difficult to get images from the outside of the body, whereas pretty much with anybody you can really get good transthoracic images. We're kind of just looking here, and what all this color is across that same valve we were looking at earlier. The idea here is that we can see if this valve leaks a lot or has a lot of blood flow going the wrong way, which would normally be seen where the valve is located there, would normally see a color jet going off to the left, which we really don't see here. I'm going to come back around on this valve.
This is sort of like weather radar, isn't it? Doppler weather
it
radar,
is.
Same thing?
It's kind of like looking at the storm coming, potentially.
This is Doppler technology and see things coming and going.
That is. And right now, we're back to, again, kind of a short axis view what we call looking down on the valve again like we started out the procedure with. And I'm doing this with the color basically to look and see if this valve leaks much at all, which it really doesn't.
Yeah, very little.
As I say, at the top of the screen, right in the middle of that circle, a little orange jet you see.
Yeah, a little dot there, a red dot, sort of.
Absolutely. And you used to kind of associate that. I was always taught that was kind of like the fire at the top of a smokestack. And that's how you could kind of see that. That might help people at home see that a little bit better. So far, we can go off color if you want, Jessica. What this really has shown us is the aortic valve really is just a bicuspid valve. It looks like it opens really nice, doesn't have a lot of leakage of blood flow, and really does not look like it's markedly stenotic or anything. Really seems to me to open up well. I'm going to go back around a little bit again. I just want to make sure with looking at this valve a little bit closer. And I really don't see, sometimes you'll see a membrane potentially or something that obstructs flow out of that valve, but I tell you, I really don't see that.
It's really moving very well, isn't it?
It absolutely is. I think you would agree with that you don't see any obstruction of flow coming through there at all.
The shape is abnormal, but the opening's good and the flow's good.
Which is what's important for this young lady. Absolutely. Right. Absolutely. We're going to go back and kind of take a little tour now and look at some other parts of the heart.
Look at some other structures.
Yeah, you might go ahead and give her a little bit more Versed, Shelley. That'd be great. You doing okay, sweetheart? Okay. All right. This here is going to be some pictures of the left ventricle in the bottom right of the screen, and that's the part of the heart.
Here are the pumping chambers.
Absolutely. Squeezes out all the blood through that aortic valve and squeezes it to the rest of the body. And the heart function, you can tell the heart really squeezes well there on the right side of the screen.
Beautiful, normal-looking heart, excellent function and squeezing, and this is a very helpful test, as is transthoracic echocardiography, to look at heart function. We do this all the time in the hospital. Patients with heart failure and other conditions to get an idea how strong or weak their heart is and tailor their treatment accordingly. Isn't that right?
That's exactly right. Jessica, I'm going to have you put some color across that mitral valve. That mitral valve is right kind of in the center of the screen now, kind of where Jessica's got that little box, and we're going to look at color flow going across the mitral valve just to see if there's any leakage back through there, which we all have some degree of leakage going back through those valves. You don't have perfectly tight valves. It's really not a system that can work like that. And if you notice every once in a while, if I get kind of a good enough image here and not play around so much,
you can see
absolutely an orange jet heading up north there. And that little orange jet is what we would call a little bit of mitral valve regurgitation, which I would call basically trivial and physiologic. In other words, normal for most people and normal for this young lady.
Nothing to worry about there.
Nothing to worry about there at all.
And the left atrium, you see that up there? Can you show us the left atrial appendage, which sometimes comes in?
I think let's go ahead and look at that left atrial appendage. We'll zoom in on that.
Oh, you give us a little update on what that's
Okay.
for sometimes and what happens with that.
Jessica, if you want to go ahead and try and zoom in on
this is an
that.
important